This is a major reversal of public health policy that had been in place for more than 30 years. The CDC vaccine panel voted 8-3 Friday to end recommending the hepatitis B vaccine for all babies at birth, saying instead that if a mother tests negative for Hep B, parents should talk to their healthcare providers to decide when or if the shot is right for their newborn. The committee still recommends newborns of mothers infected with hepatitis B or whose infection status is unknown to be immunized. Previous guidance was that the first dose of the Hep B vaccine be given to all babies within 24 hours of birth, and the 3-dose series was to be completed by 18 months. But this change is a win for HHS Secretary Robert F. Kennedy Jr. Earlier this year, he fired all 17 members of the panel and handpicked their replacement, many with vaccine-skeptic views. Babies infected with the hepatitis B virus are at risk for short and long-term complications like liver disease, liver failure, or even liver cancer. And many public health organizations have warned that delaying the first dose of the vaccine could undermine decades of progress. Janae? All
right, Alex. Now we're going to bring in Dr. Richard Besser, the CEO of the Robert Wood Johnson Foundation. Dr. Besser is also former acting director of the CDC, a pediatrician, used to work here at ABC News. It is so great to have you, Dr. Besser. You just heard Alex there lay out the new recommendations on the Hep B vaccine for newborns. For so many parents, they're now asking themselves what they need to do, what they need to know.
Yeah. I mean, this is a situation of confusion. You know, parents are hearing information from all different sides. They don't know what to do, where to get information. I practiced pediatrics for more than 30 years, and these are the kinds of things my patients brought to me. So my biggest advice is you need to talk to someone you trust. And that could be your pediatrician, your family doc, your nurse practitioner, a pharmacist. Hopefully you have someone in that category you can trust. There is some trusted information out there. The American Academy of Pediatrics, they recommend that every newborn continue to get this shot. You can look at your local health department and see what they recommend. Those are sources for trusted information. I worked at the CDC for 13 years, and it breaks my heart to say, don't go there for your information.
So we heard from some of the panel members, RFK Jr. and others, you know, the reasons behind the changes, trying to educate parents, give them options. Why do you believe, regardless of how a mother might test, why do you believe it's still important for all newborns to be vaccinated?
Yeah. I mean, hepatitis B it's an unusual infection. The infection itself may cause no symptoms in your child, but it can then live in their body for decades and eventually lead to liver failure and liver cancer. And when we started giving that vaccine to all newborns, we saw liver cancer, we saw liver failure just plummet. Wow. So the idea that that could come back is just heartbreaking. It's something that doesn't need to happen.
And you're supposed to give these shots right at birth, right? So it's really important to have a plan ready to go.
Yeah, I mean, and the reason for that is that the sooner you provide protection, the less likely a child will be to get infected. So if you're pregnant, talk to your obstetrician. If you have a pediatrician already, talk to them so you can have a plan. If you miss it at birth, it's not too late. You can still get the vaccine, so I wouldn't worry about that. But it is good to have a plan, have someone you trust, so that your child can be protected.
Dr. Richard Besser, thank you for your time this morning. We really appreciate it.